Tracking coronavirus for you tonight. A case of COVID-19 now reported in Knox County.
The state health department updating Tennessee's case count to 18 this afternoon. 14 of those cases are in Middle Tennessee, 1 in West Tennessee, now 3 in East Tennessee.
Just in the last few hours, we've been learning about the case here in Knox County. We are told the patient was exposed to the virus overseas and has been in isolation since they returned, not requiring hospitalization. Epidemiologists with the Knox County Health Department working with the state health department now to make contact and monitor anyone who may have come in contact with that patient. Although we are told this is an isolated and mild case.
Now that there is a case in Knox County, WATE 6 on your side reporter Blake Stevens has been talking with the health department about what you need to know at this point. So Blake, what is the message now to the public?
Dr. Martha Buchanan's message tonight is to focus on prevention. She fully expected the virus to make its way here, given the amount of international travel to and from our area. Again, this case is isolated, but Buchanan says there are things we can all do right now to reduce our risk later. They include practicing good hygiene and something called social distancing. That's staying at least 3 feet away from others at a big event or even church. She didn't suggest canceling every planned event in our area, but she says organizers should consider who's going and how old they are and how many of them are over the age of 60 with other health issues. That's the demographic that's primarily losing their lives to the virus overseas and here in the U.S. It's also why Buchanan says area hospitals will be limiting visitors to patients' rooms.
If you think about it, the folks in the hospital are the folks at highest risk of complications if they get the coronavirus. So we're limiting visitors so that they don't introduce that virus into the hospital or into that nursing home or into that assisted living. It's hard because people want to see their relatives when they're not well, but you can always send a card or call them or text them. There are other ways to communicate, but that protects the people that are most vulnerable in that hospital, assisted living, or nursing home.
Buchanan says it's important to think about ways to work from home or even worship from home to avoid getting sick. One of her biggest pieces of advice today, she said it many times, stay home if you are sick. And if you're undecided about whether to see a doctor, if you're feeling ill, she says do what you would normally do. If you would normally sit it out at home, sit it out at home. But if you would normally go see a doctor, call your doctor and let them know what's going on. Guys.
All right, some good advice, no doubt about it. Thank you, Blake. And again, we want to point out here, if you have some general questions about the coronavirus, the health department has now launched a COVID-19 public health line.
It really is helpful to answer frequently asked questions. That number to keep handy, 865-215-5555. Now, we're told you may get a busy signal because of the high demand, so you're asked to be patient, maybe wait a few minutes, call back. There is also a toll-free number, 1-888-288-6022. The information line is open from 8 a.m. to 4:30 p.m. Monday through Friday.